Hi YouTube, this is Care Bear. I am excited to do this video tonight because I feel like finally I have something I can contribute to the weight loss surgery community again, information wise or whatever. Like, I haven't been on, I think it's probably been since March, April, May, June, July, so almost 4 months it's been since I've put a video on, and I felt like I thought about posting a video a lot, but I found that I didn't think I had anything really new to share about my personal experience, or I didn't know what answers, or questions to answer, if you guys had any, because I feel like I was in such a maintenance stage right now. It's just kind of the same thing every day, and so I didn't really feel like I had anything to share. But I'm really excited because although this is coming from a sensitive place for me, I'm hoping that maybe that gives you guys something to look forward to, and gives myself something, a reason to check in more often with you guys. And we're going to talk about hair loss because I have found that I am significantly thinning in my hair. Excuse me. Now, I know that this is a side effect. I know that one of the side effects of the gastric bypass surgery is that between months 3 and months 5, there is hair loss. And I think they said it can last up to 7 months. So between 3 and 5, you should start to see a loss, and then at about 7 months is when you should start getting it back. Now, before my surgery, my surgeon actually told me, you have already thinning hair, so, you're going to expect even more thin hair. I don't believe that the thinning hair that I have is a result of gastric bypass. I think it is just a hereditary thing. But I am going, because I had this thin hair before my surgery, and I didn't really notice a substantial loss, additional loss, but I still feel really, really self-conscious about my hair now. So I try and style around it and that kind of thing. But you can kind of see like the thinness that is here, and I try and, pull the hair forward to kind of, block it out, but you can still kind of see like maybe like around here. I had a dozen cysts that were benign, but they were removed from my head, and so I have a scar. I have multiple scars all over, but a pretty significant one here in the part. So I kind of battle with whether I should try and cover it or whether I should make my part there so that it's not like it's a bald spot, it's just part of the part. But my part is so so thinning that I don't even know. I've tried to like part on my other side, but it's still even very very thin. If I pull my hair back and I put a clip in it and I poof it or whatever, I can see like, you can see my finger. I put it that far back and you can kind of see, that, I don't know if you can tell here, but like I'm looking in a mirror behind the camera so I can try and get like the, all this in. And I've just become really like self-conscious about it and feeling like I really need to do, I need to try and do something. Like I've considered doing ovation cell therapy, and that's something that I'm still considering doing. It's a kind of an expensive option, so I'm saving that for later, because if I find something that's less expensive that works, then I might as well do that. So I am going to actually, for over a period of time, I'm going to be doing, I don't know if you guys can see this, it's Equalign hair regrowth treatment for women. It is the generic Rogaine for women. It has the exact same active ingredient, which is minoxidil, 2% hair regrowth treatment. So I want to go over just really quickly like some of the information that they give you. I compared the men's Rogaine to the women's to see if I could figure out why one is for men and one is for women's. Well, the men's is 5% of minoxidil, so I'm not sure if that was the only thing. And that to me, it would be like, okay, well, why wouldn't I want to do the 5%? I would think that would probably be what I would want to do. One of the side effects is unwanted facial hair growth. They say stop using, or ask your doctor if you get any of that. So I don't know if it would just increase the additional hair growth on other places of the body. I don't know. On the back of the box, on the men's box, it actually says, do not use if you are breastfeeding or pregnant. So I'm assuming that there are women who do use it, and that's kind of their I don't know, if anybody wants to give information, like that they know about Rogaine or whatever, this is, again, the generic version of it, but I figure it was about $10 less. This is a month's supply, so it comes with this, the actual liquid, and then it will come with like a little dropper, and I will do 1 milliliter twice a day in my fitting area. I opened it today. It's unscented. It smells like a facial astringent kind of thing. Not really alcohol-y, not that strong, but kind of has that underlying thing. It's also kind of the consistency of alcohol, so just watery. They suggest that you do it in the morning and at night. So I'm going to do it for the first time here because I just got it today. And I'm going to go ahead and take off my rings just in case. My sides of my hair, like from here down, and then the back of my hair, I don't feel is really in need of any sort of regrowth. It's just all kind of up here in the top area. So I'm going to treat this top area, and we're going to see how it looks. And I'm going to do it. I'm probably going to try and do a video a week just so you can kind of see. They said to expect to see a change within 4 months because your hair is going to grow a half an inch to an inch a month. For people who require this regrowth treatment, a lot of times their hair grows slower, so it will take more than 2 months, maybe sometimes by 4 months. They said that we should really see an improvement. By 8 months, I think they said we should have, it'll be as regrown as it's going to be. If you don't see any improvement after 8 months, I think it was, or 7 months, to discontinue use. Oh no, it says 4 months after. If you don't see any hair regrowth in 4 months, what did they say about 8 months? They talked about the placebo versus treatment and how many people, I'll show you that in just a second. They have this little thing on the side where it shows like if you're between here and here, this probably will work for you. If you're spotty in your hair loss, then it probably is not for you. It also says that if you do not use, if your degree of hair loss is different than that shown on the side of the carton, you may have, if you have no family history of hair loss, then don't use it. If your hair loss is sudden and or patchy, don't use it. If your hair loss is associated with childbirth, don't use it. Don't use, if you do not know the reason for your hair loss, you are under 18, don't use it on babies and children. If your scalp is red, inflamed, infected, irritated, or painful, or if you use other medications on your scalp. So I'm not sure whether or not this will work with gastric bypass patients. It seems like it's more for hereditary hair loss, but we'll see, because I know that mine is, like I said, I had very thin hair even beforehand, and looking at pictures just the other day, I noticed that was the case, that I've had very thin hair for, not in my childhood, but ever since childbirth. I think my hormones just changed, and my hair changed, and the quality of the hair and the whatever. Okay, so this is the amount that we're going to do. I have it a little above the line. Let me see. I'm just going to squirt it in the area and just kind of rub it through my fingers and see, try and part it down the middle. You guys can kind of see like how thin that is. Okay, oh yeah, it's drippy. So I wanna kind of see, like, it's at nighttime right now. It's about 10 minutes to 10 p.m. on the 3rd of July. Happy 4th of July, everybody. So I had heard people say that it's really greasy, and so it's kind of hard to do it like in the morning and then leave for work with greasy hair. This was a long time ago though, so I don't know whether or not this is the kind of thing where, yeah, it kind of looks like it's greasy or it looks like it's wet, but I don't know if it's the kind of thing that will dry normal looking. It smells pleasant. It's not an icky smell. It smells clean. It smells kind of like a facial cream or something. It also said that you have to continue to use it. If you stop using it, like let's say you're using it for 8 months and you're really noticing your regrowth in your hair, and that's great, and then you decide you wanted to stop using it, that you would continue to lose your hair. So they said to continue to use it. So, and you know, that's really okay with me. Like if I found that my hair was regrowing and I felt like it was healthy and it was thicker and I didn't feel as thin in the hair category, I would be happy to spend $20 a month, you know, for a product that would continue to allow my hair to be that way. So, oh, I just realized this squeegee thing actually twists back on here. I didn't even realize it, but that's kind of nice to have that. I don't have to keep the cap and that separate. My hand that I use to kind of push it all through is a little bit, feels a little bit greasy. Not really sticky too much, but just I'll probably wash my hands afterwards. That doesn't really give me good. I should probably not touch my eyebrows unless I want really bushy eyebrows. So it'll be just interesting. The amount was perfect for my area of growth. I will probably reread through the directions and see if they say like how long you should leave it on, because I have the benefit of not working outside of the house, so I'm able to, like, let's say, well, let me just read it to you guys here. Directions for use: remove the cap to remove, push down and turn. Okay. Part your hair in the area of hair thinning and loss. Follow the instructions below to using the dropper applicator and apply 1 milliliter 2 times a day directly onto the scalp in the hair loss area. Do not use more. Spread the liquid evenly over the hair loss area. If you use your fingertips, wash hands with soap and water immediately. Each bottle should last about 1 month if used as directed. Use a mild shampoo if you wash your scalp before applying the topical solution. Use a mild shampoo if you wash your scalp before applying it. Okay. Using the dropper applicator, squeeze the rubber bulb. Yes, yes. Release the bulb, allowing the dropper to fill. Next, place the tip. I guess I should have read this before, but it seems like I did it. It seems very user-friendly, and I always forget the words. I'm not a dumb person, but like I can't ever think of the words when I'm here in front of you guys. So like, it seems pretty self-explanatory. Place the tip of the dropper near the part of the scalp you want to treat and gently squeeze the bulb and gradually release the solution. To prevent the solution from running off the scalp, apply a small amount at a time. After each use, attach the dropper to the bottle to make it child resistant by turning it clockwise until tightly closed. If you have any questions, and then they give your thing. So that is it. I'm going to go ahead and oh, really quickly, I did talk about like the placebo versus actual medication. So after 8 months, let me see, I'm gonna move it. Oh man, okay, sorry guys. Oh jeez, please. Okay, so after 8 months, this shows the placebo for at the bottom is minimal. What was it? Minimal regrowth. The top tiny little sliver color is moderate regrowth, and then this is for the actual medication. So it was 33% on the placebo after 8 months said that they saw minimal growth. 7% said they saw moderate growth. With the actual medication after 8 months, 40% said that they experienced minimal growth, and 19% said that they experienced moderate growth after 8 months of use. So I don't know if that matters to anybody else, but like, I just thought that was kind of interesting. It was in a clinical study of mostly white women aged 18 to 45 with moderate or mild to moderate degrees of hair loss. The following responses are to this medication. So I thought that was interesting. But I got to stop touching my face before I go wash my hands. So I'm going to go do that before I start having my hairy fingertips. Anyway, I'm happy to be back and have something interesting to share with you guys and kind of experience with you. I don't know if you can even tell right now, if you can see a difference. I'm actually not too disappointed with the way it looks. Like, it does feel a little bit greasy. It kind of feels like I put in like a shiny, like a camera ready, I can't think. Maybe it's because I'm trying to do a video at 10 o'clock at night. like a finishing spray, like if you put on a finishing spray or finishing serum on your hair, or like a flyaway, like sometimes if you put like a frizzies kind of a serum kind of on your hair, if you put a little bit too much, it's kind of what this feels like. So it's a little bit like, I don't know if you guys can tell, like the separation of the hairs a little bit, if you can kind of see that. It does look a little bit greasy, but like, yeah, I'm not horribly disappointed in that. I mean, it's like, I guess it just looks like I didn't shower today. I mean, I guess if I look like I didn't shower today every day, maybe that's gross. I don't know. But as long as it's not an increasingly gross thing. So, yeah, it's not bad. I don't have a problem with it. What do you guys think? I'd love to hear. Alrighty, we'll talk to you soon. Bye, guys.